Hello again, and welcome to the video lecture for this module on heart failure discharge education. So you might be asking yourself why an entire module is dedicated to heart failure discharge education. The answer is quite simple. Heart failure discharge education is so important because evidence shows that providing high quality and patient-specific discharge education for patients with heart failure significantly improves their outcomes. This means they are living healthier lives, transitioning more easily to living independently or managing their condition outside of the hospital. And this means that they are less likely to be readmitted to the hospital in a 30-day period. Our hospital has been recognized by the American Heart Association and the Joint Commission with the Advanced Certification in Heart Failure since 2015. This is awarded to hospitals that meet the highest standard of evidence-based practice for heart failure patients. These standards include discharge education. Please review the websites from the American Heart Association and the Joint Commission from the resources page for more information about this. So, in regards to providing evidence-based and high-quality discharge education, there are 6 topics that need to be included. These topics are diet, activity level, daily weight, medication regimen, signs and symptoms of worsening condition, and follow-up instructions. This can definitely be a lot to keep up with. So our cardiology units developed a tool to help nurses make sure that they are including everything in the discharge teaching plans. A copy of the RN Heart Failure Discharge Education Checklist is provided on the Learning Activities page for you to review. This tool is used for all patients with a heart failure diagnosis and allows you to apply their information and physician orders to create a comprehensive discharge plan. So now we can take a closer look at each of the 6 topics on the RN Heart Failure Discharge Education Checklist. If you would like more information about heart failure and standards of care, please refer to the American Heart Association and the Joint Commission resources page. The first item on the list is diet. Oftentimes, physicians order low-sodium diets and fluid restrictions for patients with heart failure. Additionally, physicians will also recommend alcohol reduction or cessation. When I'm teaching patients about sodium and fluid restrictions, I like to review how to read nutrition information labels and how to identify low-sodium foods. And also reviewing the volume of common beverages and other fluids is a good idea too. The desired activity level will also vary from patient to patient and will be specified by the physician. But the goal is always to balance activity with rest to avoid overexertion and fatigue while still promoting healthy activities. Activity restrictions include any activities that need to be avoided and can also include specifications on activities such as how long to exercise and how vigorously. Daily weight is an extremely important topic, as weight gain can be one of the first signs of worsening heart failure. So we need to assess and make sure that patients have access to a scale every day. And if they do not, then please order a case management consult so that one can be provided to them. We need to teach patients to weigh themselves every day using the same scale and wearing similar clothing. They should weigh themselves first thing in the morning after voiding and before eating or drinking anything. And after weighing themselves, they should record their weight on a calendar or log immediately so that they can notice how they are trending. And then they must verbalize that they know to call the doctor for any weight gain of more than 2 pounds per day or 5 pounds in a week. Medication regimen for managing heart failure can be complex, and so it is critical that patients with heart failure comply with every detail of their medication orders. We need to make sure that they understand the name and purpose of each medication, how much to take, how to take it, how often, and if any of their prescriptions have changed since before they came to the hospital. Their medications typically include beta blockers, an ACE or an ARB, and diuretics. And more detailed explanations of these medications can be found on the American Heart Association website. That can be found on the resources page. We need to make sure that we're not just listing the signs and symptoms of worsening heart failure, but also what to do if they experience any of these signs or symptoms. So please make sure that for each sign or symptom, you're also explaining when to call the doctor or to call 911 or to go to the emergency room. And this information will be found in the physician discharge orders. So last but not least, we need to review follow-up instructions. Patients with heart failure must have an appointment with their cardiologist within 1 week of discharge. This appointment must be made by nursing if the physician has not already done so. We must provide the appointment date, time, and location to the patient in writing. We also need to explain that they need to go to this appointment even if they are feeling better. This appointment is important for continuity of care. And while it'd be really great if they feel so good that they don't want to go to the doctor, we still need to reinforce how important it is to go anyway. So I just want to reiterate some key points here. Heart failure discharge education is so important because it improves patient outcomes. For heart failure discharge education to be effective, it must include diet, activity orders, weight monitoring, medication regimen, signs and symptoms of worsening condition, and follow-up instructions. The RN Heart Failure Discharge Education Checklist is the tool that will allow you to apply all of the patient information and physician orders and create the best discharge teaching plans for your patient. Thank you for listening to this video lecture, and I'm looking forward to reading your case study discussion boards.